Glad you could be with us. Got to check, make sure. We got a lot of cameras going on at once. Want to make sure everything's happening at once. That's why we don't start the show for a few seconds. Welcome. First time joining us. Welcome. Glad you could be here. The way this works is I talk for 24 minutes. You, whatever platform you're on, we're on several platforms right now, you can type in any health questions you might have. My producers, John and Garrett, will then read the questions to me at the 24-minute break. Then we do another 24 minutes, and then we answer more health questions. This is an amazing opportunity for you to get your health questions answered. So many of you have health questions, and you don't know where to turn. I want to be that source. I don't have all the answers. I can't make promises or guarantees, but I can tell you I got about 40 years experience. So I usually have somewhat of an answer for you. So it's a lot of fun. So we're ready to start whenever you guys are. Are you ready? Okay, give my clock. There we go. Ready? Hey, folks, Dr. Joe Esposito here. I am so glad you're with us today. We're going to talk today about digestion. Now, the number one reason we see patients in our clinic is pain. Neck pain, back pain, shoulder pain, headaches, car accidents, sports injuries. The number two reason we see patients is digestive problems. Heartburn, acid reflux, burping, gas, bloating, diarrhea, constipation. How many of you have that? Raise your hands. I know you do because I've been in practice and I've seen patients, including my internship for about 40 years now, and I see a lot of you with digestive problems. I believe everybody has digestive problems. We just don't talk about it. It's not first date conversation, right? So I want to talk about your digestive system, and we're going to give you so many insights in the next few minutes about what's going on, what to do to fix it, what you're doing that breaks it, and then hopefully at the end of this, you're going to have this incredible amount of knowledge to say, wow, I can work on this. Because digestion is so key to health. I think it was Hippocrates who said all disease, look to the colon for the cause of all disease. So we have to get the digestive system working. And we just beat the heck out of our digestive systems. I mean, think about what your digestive system can do. You can eat a double beef cheeseburger with artificially processed cheese food spread, white bread, bromine, which blocks up your thyroid, sugars, additives, chemicals, heterocyclic amines, polycyclic aromatic hydrocarbons, which are the grilled marks that you get on a burger. Those are all carcinogenic. It can take that double beef cheeseburger and turn it into eye tissue, into blood, into toenails. So your digestive system is so incredibly advanced. We don't have a machine in the world that comes close to be able to doing what your digestive system can do. And yet, for some reason, you just beat the heck out of it every single day. I want you to stop doing that. If you can survive on double beef cheeseburgers, imagine how well you'd thrive by just eating foods that your body needs, putting the nutrients in your body that it requires. It's so easy, it's so quick, it's so inexpensive, and just by doing it for the things we're going to talk about 1 or 2 days, you'll be blown away and say, oh my gosh, this is all it takes to not have gas, bloating, diarrhea, constipation, acid reflux, irritable bowel syndrome. Again, I can't say I can cure anything, but the tips we're going to give you today are going to change your life forever. There's about 28,000 days in a life. Today changes your life. You'll never forget this one. So let's talk about ways to improve your gut health. There's a bunch of tips I'm going to give you. Gut health is linked to so many different diseases. So keeping your digestive system on track is one way to reduce the risk of getting these diseases now and down the road. So number one, keeping the body in motion. Your body is designed to be in motion. It's not designed to sit around all day. Now, as we get older, I admit this, I don't move as much as I used to. You know, where I go for a 3-hour hike, I might go for a 1-hour hike now. Where I used to be able to do 5-6 hours of yard work, I can maybe do 1 or 2 hours of yard work. So we do slow down, but keep the body in motion. And the colon, of course, has nerves on it that cause the colon to squeeze. It's called peristalsis, to push things through the colon like a tube of toothpaste. So as we get older, our peristalsis capabilities gets weaker. So by physically staying in motion, by walking, by doing yoga, by exercising, we're facilitating or helping the colon do its job. So diet, of course, is so important to your digestive system. You want to stay away from what we call ultra-processed foods. Now, this is a new word, ultra-processed. Ultra-processed means it has ingredients in it that you wouldn't normally find in the average person's pantry. So if I have vitamin B, well, I might have vitamin B in my pantry. I might have fruits and vegetables, nuts and seeds. I would have that in there. But I probably wouldn't have hydrogenated oils. Maybe I would. I don't know. I wouldn't have autolyzed yeast, hydrolyzed vegetable proteins. So if you look at an ingredient and say, I probably wouldn't have this in my pantry, you probably shouldn't eat it. That's an ultra-processed food by definition. These processed foods break down more easily into sugar, and that has a negative impact on your digestive system. So many of you right now have what's called a systemic yeast infection. Now, how do you know this? Well, you could have a skin rash. Many times skin rashes, like something called tinea versicolor, which is a fungus, is a sign of systemic yeast infection. Jock rash, athlete's foot, itchy anus. These are all signs of systemic yeast infections. So here's a little test I want you to do. I want tomorrow morning, when you wake up, but before you go to bed tonight, I want you to put a clear glass of water next to your bed. And when you wake up, first thing, before you get out of bed, before you pee, before you do anything, get a mouthful of spit. Scrape your tongue with your teeth, get a mouthful of spit, and spit into this glass. Wait up till an hour. If you start to see little tentacles coming down like a jellyfish, chances are you have a systemic yeast infection. If the spit just floats on the top of the water, you're fine. So it's an easy, quick, free test that you can do to determine where our gut health is. It's one of the many tests you can do. If you have a systemic yeast infection, I won't have time to cover it today. Shoot me an email, drjoe.com, and send me an email through the website. I'll send you a link to the protocol that I suggest for that. Systemic yeast infections are hard to get rid of. Now, we can give you a drug that can wipe it out pretty quickly. However, that same drug also has a tendency to wipe out your liver. Not wipe it out, but cause damage to your liver. So I don't recommend you do that unless it's serious and it's going to kill you. Then, maybe do it then. But I really want you to consider doing it naturally, because as you go through the process of fixing the systemic yeast infection, you're doing a lot of other good things for your body. If you have a systemic yeast infection, you could never obtain optimum health. It's going to be adversely affecting so many different aspects of your health. It's been linked to a lot of different diseases. So systemic yeast infection, not a good thing. Now, we can do tests on you. We can do blood work on you and things like that. But the spit test is a simple, easy screening test to see where you are. If you're eating ultra-processed foods, things that are high in sugar, it's feeding the yeast. If I was going to make bread, what do? I take warm water and yeast, mix it together, and what do I add to it? Sugar. And the yeast eats the sugar, and then it creates gases that makes dough rise, right? So if you're terribly gassy all the time, you might have a systemic yeast infection, and you're making gas. Just like you make gas to make the dough rise, you're doing that in your colon. And so we have to look at the systemic yeast infection and then deal with it accordingly. It's not good. And many of you have this condition. So again, if you have the question, send it to me, drjoe.com. You did the test. It was positive. I'll send you the protocol I recommend. You want to eat smaller meals and avoid overwhelming your digestive system. If you eat something like a heavy protein, let's assume I'm going to have a steak. I'm not, because I don't eat meat, but I'm going to have a steak. I eat that steak. It can take up to 6 hours to get from your stomach, out of your stomach, into your small intestine. So let's assume I eat a steak, and then 3 hours later I eat, something else. Anything. That steak is sitting in my gut, and it's digesting. And it's about halfway done at 3 hours. Then I throw something else on top of it. Beans and rice, a hot dog, whatever it is. Now my stomach is saying, wait a minute, what do I digest? Do I continue digesting this steak for 3 more hours? Or do I start digesting this hot dog, these crackers, these chips, whatever it is? And so it messes up your digestive system. You have to wait, in a perfect world, for your stomach to be empty before you put something else on top of it. If I were to eat cantaloupe is out of my stomach in about 20 minutes or a half hour. If I eat steak or meat, any animal products really, it can take up to 6 hours. So are you willing to wait 6 hours between meals? You should, if you're eating a heavy animal protein. Because if you don't, you're really putting a stress in your digestive system. And that's one of the biggest sins that you do every day. And I want you to stop it. think about what you're eating. If you're eating a plant-based meal, okay, which is what you should be eating anyway, probably about 3 hours later, 4 hours later, you could eat. If you're eating animal proteins, I'm begging you, please wait at least 6 hours. I prefer you don't eat the animal proteins, but wait at least 6 hours. So make sure you eat the easy-to-digest foods. It's going to make life a whole lot easier. And a simple way to know is when you start getting hungry again. So many times we eat because we're bored. We're at an event. We're at a party. We're on a date. We eat because it's time to eat. I want you to eat because your stomach is empty and it's time to put more food in there. And you get a little hungry, it's time to eat again. Now, what I find with me, personally, I'll give you a little personal insight into my gut. If my stomach is pushed up against my diaphragm, it's called a hiatal hernia sometimes if it's bad enough. Sometimes it's not quite there to be diagnosed yet. But if my stomach is up against my diaphragm, I want to keep eating even when I'm full. I know how my stomach is only about the size of my fist. So it can swell or expand like a balloon. But if I put the amount of food the size of my fist in my stomach, that would be ideal because then my stomach is easy to digest. When I stuff myself, and I've done this because I know when my stomach is acting up, I can't stop eating. I want to eat more. Maybe the food is so delicious, I want to keep eating it. And as a plant-based connoisseur, a lot of the foods that I eat are so delicious, I don't want to stop eating them. So if you have too much food in your stomach and you know you're full, then the stomach is up against the diaphragm. Good example. I forget what I had the other day. And it was enough food, but I still felt like something. So I ate a couple of handfuls of pistachios. And I ate the pistachios, and it was too much. And I went for a long walk. I went for a hike along the river, a place in Roswell, Georgia. And I went for a hike along the river, and I was just so full. And I thought I shouldn't have eaten those pistachios. I should have stopped when I knew I had enough food. But it takes 20 minutes to get the message from my stomach to my brain. And in 20 minutes, I can eat a lot of food. So I blew it. I shouldn't have done it. And I felt it. And I didn't enjoy my hike as much. And it took me about an hour or two to get the stomach to feel less full. So don't overeat. It's one of the biggest sins you can do when it comes to nutrition. And don't keep stacking food on top of food on top of food. Give your stomach a chance to digest, pass it into the small intestine, then you could add more food to it. So if you're just tuning in, folks, I'm Dr. Joe Esposito. What we're talking about today are ways to improve your gut health. Things that you can do every single day and should do every single day because the gut is related to so many different diseases. In fact, I can't think of one disease known to man that wouldn't benefit from you taking care of your gut. May not fix it, but you'd benefit from it. So why are you beating yourself up? Why are you eliciting disease processes when you don't have to? And a lot of it is because you don't know. No one ever sat you down and just told you what I just told you in the past 12 minutes. So this is why these shows are so important. And that's why I really want you to share these shows with everybody in your contact list because it changes lives. It saves lives in many cases. All right, other things that can adversely affect your digestive system. How about stress? So let me explain to you, Lucy, if you're old enough, you get the reference, how digestion works. There's two types of nerves in your body. There's sympathetic nerves. Sympathetic nerves speed you up. Right now, I'm in the sympathetic mode. My brain is racing. I'm excited. My leg is bouncing up and down. I'm in the sympathetic mode. Parasympathetic nerves slow you down. Sleep, digestion, going to the bathroom, sex, just sitting around doing nothing. That's parasympathetic. So in our body's supposed to be switching between sympathetic and parasympathetic constantly, very, very, very quickly. Because some things I do are sympathetic mediated, some are parasympathetic mediated. So if I'm always in the sympathetic mode, if I'm always speeded up, I'm not able to downshift into my parasympathetic mode, which then allows me to properly digest my food. So if you're under stress, there's three types of stress: chemical, physical, and emotional. If you're under stress, you cannot properly ingest, digest, and absorb your nutrients. Can't do it. Because digestion, again, parasympathetic function. If you're stressed out, you don't feel like being involved in romance. Why? Romance is a parasympathetic function, and you're in a sympathetic mode. It also speeds up the aging process. So if you have neck pain, back pain, shoulder pain, numbness, tingling, headaches, digestive problems, you're in that sympathetic mode most of the time, and you're not able to heal. You're not able to digest. So when it comes to physical stress, my team of doctors and I are really good at dealing with physical stress on the body. So if you have pain, come see us. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. I and my team of doctors would love to be your doctors. We'll check the nervous system. We'll check the digestive system. We'll check your diet. We'll find out why you're having these nervous system problems and stabilize that. Calm down the nervous system. Your nervous system is under stress. We want to calm it down. Then you're able to shift into the parasympathetic mode, remember the slow down mode, and that's going to help you digest your food better and help your body heal and help you sleep and have a better sex life. And everything changes between the sympathetics and the parasympathetics if they're off balance. So if you want to make an appointment, drjoe.com. We can see you. All our offices have new patient appointments every week. So we can get you in pretty much right away when it's time to make your appointment. We accept people with all insurances. It depends what your insurance covers, but we accept you. Good portion of our patients don't even have insurance, and that's fine too. Because the work we do, chiropractic care is the most effective, least expensive treatment when it comes to back pain for back pain. But in our office, we go way beyond that. We work on the digestive system. We work on your diet. We look at see if you have deficiencies, maybe some supplements, maybe certain foods to add. We want to get you well and keep you well. We have a medical doctor on staff. We can do things like PRP, platelet-rich plasma, where we take your blood, take out the growth factors, take out the blood, spin it down, take out the growth factors, and inject it back into your body to stimulate new cell growth. It's amazing. We can do trigger point work. If the muscles are so tight, sometimes you need a medical injection to get the muscles to relax. So we have chiropractic, we have medical, we have nutrition, we work on brain function. It really is a one-stop shop for a lot of your health problems. So I suggest you make your appointment right now. Stop suffering. drjoe.com. We'd love to see you. drjoe.com. We can do remote consultations too if you can't come to the office. So what I'm talking about today is helping your gut, fixing your gut. So we're talking about sympathetics and parasympathetics. Sympathetic nerves speed you up. Parasympathetic nerves slow you down. And if you're in the sympathetic mode, it's hard to shift to the parasympathetic mode to go to the bathroom. So a lot of patients with irritable bowel syndrome, colitis, constipation, diarrhea, many times it's an imbalance between the sympathetics and the parasympathetics. Little trick you can do. You're having stomach pain. Now, if it's really bad, of course, get to the emergency room. But you're having stomach pain, it's chronic, you have constipation, diarrhea, you can kick in your parasympathetic nervous system. And a simple little thing you can do is take a hand towel, wet it, and dip it in hot water if you have it, or wet it and put it in a microwave. I don't recommend using microwaves, but in this case, you're not eating it. And then lay the towel over your abdomen, whether it's for you, works great for children too, pets. Lay the warm towel on them, shifts you into the parasympathetic mode, laid across the abdomen. And it's amazing how well that works. Some of you may not be able to get to sleep. And I say a wet towel, not dry, because dry is usually plugged into the wall. That's electromagnetic frequencies. That's a whole nother lecture. I don't want electricity that close to your digestive system. So wet towel, put it on there, calm yourself down. Many times it helps with constipation, gets the bowels moving. Help with diarrhea. If the bowels may be spasmed, then everything's passing right through you. This calms the bowels down too. So I'm giving you a lot of home tricks that you can do in today's show. So a lot of fun things that you can start doing to calm down that sympathetic downshift into the parasympathetic nervous system and let the body heal. I haven't even talked about food yet, have I? So much of your health problems are physical, not chemical. Let me say that again if you didn't understand it. Many of your health problems are physical, not chemical. And in this case, we're talking about physical things that you can do. I'm going to talk about a way to reset your colon in a second that you can do yourself. So physically, we want to make sure the digestive system is working properly with the sympathetics and the parasympathetics balanced. Now, a lot of people come to me and they ask about probiotics. Probiotics are good bacteria in your gut. Prebiotics are the food that feed the probiotics. Probiotics, bacteria. Prebiotics are the food that feed the bacteria. Now, a lot of fermented foods, such as yogurt, sauerkraut, kefir, they're pasteurized after they're made. So even though they may have, millions and billions of bacteria, that's usually counted before it's pasteurized. After it's pasteurized, for safety reasons, you kill off a lot of those bacteria. So if you're going to do something that has probiotics in it, kefir, sauerkraut, yogurt, try to get it unpasteurized. Better yet, just make it yourself. This is one of the reasons why I suggest you take a quality probiotic supplement. I take one every day. Quality probiotics are the good bacteria that go into your colon. Then I also eat a good diet. I take things like Dr. Joe's Super Greens, Dr. Joe's Essential Source. I eat a lot of fruits and vegetables, and those are prebiotics, which then feed the probiotics that are in my colon. So you got to get them there and then feed them. And that's what a prebiotic is. And prebiotics come from undigestible fiber, and you get that from eating fruits and vegetables. Now, a little trick you can do is if you do eat carbohydrates, let's say you're going to want a potato, okay? What I want you to do, potatoes, pastas, I don't recommend pastas, rice, I don't recommend it, but if you're going to do it, cook it, put it in the refrigerator overnight. Eat it the next day. You can warm it up or eat it cold, either way. Now you've created something that is called a resistant starch. So I take a potato, bake it, boil it, whatever, put it in the refrigerator, eat it the next day. I'm going to absorb 40% less carbohydrates, calories, than I would if I just boiled the potato and ate it, because I created this resistant starch. The good news is the carbohydrates that I don't absorb, many of them become prebiotics, feeding the good bacteria. So if you're going to eat carbohydrates, rice, grains, potatoes, I'm going to recommend you cook it, cool it, eat it the next day, hot or cold, or day after, whatever it is. That creates a resistant starch. That little tip alone can change your life. Just having a resistant starch is amazing. And you're going to have a lot less gas, a lot less bloating. You're going to gain less weight, and you're going to feel so much better than just eating, cooked pasta or cooked rice or cooked quinoa. So resistant starches are something I want you to understand you should do. Super Greens and Essential Source, I just mentioned them. Super Greens and Essential Source are 2 powders. It's the minimum supplements I recommend people take every day. So if you go to my website, drjoe.com, go to the store. There's a little link on there at the top that says store, a little tab. And they're the first products in the store. Super Greens has chlorella and spirulina, which helps clean out the liver. Omega-3 fatty acids from algae. And it has a lot of iodine in it because it has sea vegetables in it. Essential Source, I named it. Get your essential nutrients from the source, which is what? Fruits and vegetables. So it's fruits and vegetables, prebiotics, probiotics, digestive enzymes, complete multivitamin. I was working the other day. I saw a patient in an emergency, and one of my secretaries hung around late to help me out, which was wonderful of her. And at the end of the day, patient was gone, and we don't have a lot of personal interaction because we're always with patients and other doctors. And she said, Dr. Joe, how come you don't have any wrinkles? She said, I know how old you are. You should have wrinkles. I said, well, a lot of it has to do with a good diet. And a lot of it has to do with taking the right supplements. Now, it's not genetics. My parents aged well, but I mean, they had wrinkles when they were my age. So a lot of it has to do with getting something called antioxidants in your body. Free radicals are chemicals that eat away at your body, like acid or Pac-Man, waka, waka, waka. They eat through things. The antioxidants stop that damage from occurring. It stops the free radicals from causing damage. And then the pre and probiotics help keep my immune system strong. They help my digestive system. They help keep my skin fresh. They keep the bacteria in check in my body, viruses in check in my body. So we have the answers to a lot of your health concerns. But you have to ask me the question. People travel from all over the world to see us. And they always say, how come we don't have doctors like you in my country? And I said, I don't know if we have doctors like us in our country. So if you'd like to make an appointment, love to see you as a patient. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Go to drjoe.com. Book it right there online. Call us if you have any questions. We're happy to answer questions. All the supplements we talk about, Super Green, Essential Source, probiotics, digestive enzymes, they're all on the website, drjoe.com. If you have any questions, send them to me through the website. I'm happy to answer your questions. drjoe.com, little bot pops up. Just click on that, or it says contact us. And I want you to follow us on social media at Dr. Joe Esposito, all one word, at Dr. Joe Esposito. We post health tips every single day. Facebook, Instagram, YouTube, TikTok, all free. at Dr. Joe Esposito. But make an appointment to come see us either virtually or in person, drjoe.com. Folks, I'm Dr. Joe Esposito. We're going to be right back. Part 1. That went fast. God. Fastest 20 minutes on radio. You have questions for me?
There are a few questions. The first one is, I have a very low functioning gallbladder. I had a HIDA scan and ultrasound, and I have no stones and no pain. Should I get it taken out? What can I do for it?
Okay. I'm not a surgeon, so I can't tell you to have it taken out or not taken out. I will tell you, if it were me, I would not want it taken out because you need your gallbladder to store bile to digest fats, because if you have your gallbladder taken out, you increase your risk of heart disease because you're not digesting fats. So, a couple of things we need to do. Number one, there's some certain supplements I would recommend. Glutathione, of course, I would recommend for that. Super Green's an essential source, of course. And then what you want to do is shoot me an email with your question. And there are other supplements that aren't Dr. Joe supplements. Other companies carry it, and I can give you those recommendations as well. And we want to get the liver working the best it can to try to jumpstart the gallbladder. I would strongly advise chiropractic care because the nerves in the mid-back control the gallbladder and the liver, and if they're being pinched, that may be why it's just not working. The brain isn't getting the messages to the liver and gallbladder like it's supposed to. And if you're in the Atlanta area, I'd love to see you because there's actually a liver massage we can do, and it can actually help detoxify the liver, squeeze the junk out of the liver, and jumpstart the liver as well. So, yeah, I would say Super Green, Essential Source, Glutathione. Actually, shoot me an email, and I'll give you the whole protocol for that. But if you can avoid having any surgery, my opinion is avoid it. What else?
I would love to get off omeprazole. I've been on it for years, but the minute I stop, the GERT comes right back. Are there dangers of endless acid blockers? Are there any alternatives?
If you read the directions on your acid blockers, they're designed, most of them, I don't know about the one you're taking, most of them designed to be used for 14 days. How many people have ever just used an antacid or acid reflux medication for 14 days? And even if you did, what's your answer? So go to my website, drjoe.com, and type the word GERD in the search bar, GERD. It's an article that I wrote about how we work on patients with gastroesophageal reflux disease, heartburn, acid reflux, and it's a really amazing technique that we've come up with and a protocol that we've come up with. So type that in, and if you're in the Atlanta area, the best thing to do is come see us. Because the number one reason we see patients is pain. Number two reason we see patients is digestive issues, and we adjust the stomach between me and my father, the doctors, probably about once every 15 minutes. It's a very common situation, and I can't take you off the medication, but I'd love to get you healthy enough so you don't need the medication. So read the article on GERD. If you're in the Atlanta area, come see us because, acid in the esophagus is dangerous and could lead to serious problems, even as far as cancer. So you want to get that fixed if you can. All right, what else?
Can you get rid of parasites completely, or do you need to be on a daily medication indefinitely?
Well, we all have parasites in our body, so you never want to get rid of them completely because some of them are good, okay? It depends what parasites you have, and there are parasite flushes I can recommend, so if you shoot me an email, I might give you a better recommendation for that. So, all right, what else?
What is the best way to treat psoriasis?
Psoriasis, and again, I'm not a medical doctor, but what I've seen work very well is cleaning out the liver. Whenever I see a skin condition, I always think liver. So I want you to stop eating wheat and dairy products as of right now, this moment in time. No wheat, no dairy, not a bite, not a nibble, not a sip, 0 for 60 days. I've never seen somebody not see improvement by just doing that. It's not going to go away. Sometimes it does. But that's going to help. Then supplement-wise, Super Green, Essential Source, Glutathione, enzymes, Dr. Joe's enzyme support, probiotics, and then we got to fix the liver. And so, again, if you want the whole protocol, just shoot me an email. I'll give you the whole protocol. But whenever I see psoriasis, I've never seen it not be the liver, and I've never seen it not somewhat improve, if not totally improve, by giving up wheat and dairy products. What else?
What can cause the tip of the tongue to turn red?
You may be having a reaction to food. That's a lot of different things, so I don't have a quick answer for that one. It could be a reaction to food. I know if I do anything salty, the back of my tongue turns red, not the tip. It could be a circulatory issue. It could be a neurological issue. So I would need to do a neurological workup with that to see if there's any pinched nerves going to the tongue, and then also checking to see if there's a circulatory issue. Maybe you have clogged glands. They're usually on the side of the mouth, not the tongue, but stranger things have happened. So I would say get a chiropractic evaluation to check the nerve supply to the tongue, and then we can do a nutrition evaluation if you come see us, and let's see if there's something that might be causing it. I don't have a quick answer for that one. What else?
Sometimes I have a muscle type sharp pain under my left rib. If I stand up really straight and push on the area, I can feel something slide back down. This is very painful. Do you know what this is and how I can avoid it?
Could be the stomach. Again, I have to check you specifically, but it could be the stomach pushing up against the diaphragm, and that can cause that sharp pain. It could be a rib out of place. Ribs misaligned, just like the spine, just like any other bone in the body. So if you feel the rib, if it's a stomach, then we got to pull the stomach down. If it's a rib out of place, got to adjust the rib. So once again, that's something I have to look at to see. So if you do want to make an appointment, just go to drjoe.com. We'll check it for you.
What probiotics do you take?
I take Dr. Joe's probiotics. I'm looking to see if we have one here. There it is. That's the one I take, Dr. Joe's probiotic. And I think it's the best in the world. It's my opinion. So I take this one every day. It's on the website, drjoe.com. And John can ship it to you either the same day or the next business day. What else we got on other platforms?
This is all I have so far.
Okay, well, that's good enough. All right, folks, going to do another 24 minutes, and then I'll answer some more questions. So hang on, type your questions in as I'm talking for the next 24 minutes. Let's see. We talked about prebiotics and probiotics. We talked about resistant starches. All right, ready? Hey, whoops, hang on. Let's start it again. Ready? Hey, folks, Dr. Joe Esposito here. What we're talking about today are things that you can do to help improve your digestive health and your gut health. And I said earlier that the number one reason that my doctors and I see patients is for pain. Neck pain, back pain, shoulder pain, wrist, elbow, hip, sciatica, any pain in the body. My team of doctors are really good at trying to get to the cause of the pain and then fixing the cause, not just treating the symptoms. Can't help everybody, but many cases, most cases, we get amazing results. The number two reason we see patients is digestion. Heartburn, acid reflux, burping, gas, bloating, diarrhea, constipation. And we're talking today about what you can do. I gave you a lot of tips earlier that you can start doing at home. Don't need me to start getting the digestive system well. Now, I want to talk about your breath for a second because this is an indicator that the digestive system isn't working properly. So what happens is you have a sheet of muscle called the diaphragm. It's right in the middle of your body. And your stomach sits below the diaphragm. And there's a valve called the ileocecal valve. And when you eat food, the valve not the ileocecal valve, I'm sorry, lower esophageal sphincter. I'm going to talk about ileocecal later. The lower esophageal sphincter, it opens, food drops in the stomach, the lower esophageal sphincter closes, you digest food, and you pass it on. That's normal digestion. Many times, because we eat too much, the stomach gets too big, it can push up into the diaphragm. Maybe there's a neurological issue. Maybe you have a pinched nerve going to the diaphragm. Maybe you're just old. The muscles get weaker. It happens when we get older. What happens is the stomach can push up into the diaphragm. So if that happens, you might have burping, gas, heartburn, chronic cough. Acid is coming up into your throat. Sinus problems. Acid comes into your sinuses. But here's the thing. We've all met people like this, and they just have such rancid breath. And it smells like an outhouse. That's almost always a sign that the stomach is up against the diaphragm and the food is not digesting properly in your digestive system, and it's essentially sitting there and rotting. And when it rots, the gases get absorbed into your blood system, which then get into the gases are exchanged then in your lungs, and it comes out through your lungs. So you can't brush that one away. You can't gargle that one away. That's coming from the gut. And every case I've ever seen like that, not saying it happens all the time, but in my experience of seeing patients for almost 40 years now, we take the stomach and pull it down away from the diaphragm, actually adjust the stomach. And when we do, and we got to check the nerves from the spine as well, because that's involved oftentimes. When we do, you start digesting food again, and the breath freshens. And I've had people go to dentists, and they've done x-rays, and they've done exams, and they say, there's nothing wrong with your teeth. It's coming from the gut. Nobody knows how to fix it, and that's what we talk about. It give you ideas on how to fix it. So if you go to my website, drjoe.com, if you have acid reflux, heartburn, terrible breath, Type the word GERD, G-E-R-D, in the search bar. That stands for gastroesophageal reflux disease. Type GERD in the search bar, read the article that I wrote on how we treat cases like that in our office. And we'd love to treat you if you have these cases, because you're not digesting your food, so you're not absorbing your nutrients properly. You're creating a lot of gas. You're putting stress on a digestive system. It's a very serious issue. It's not, hey, Joe's got really bad breath. It's, hey, Joe's got really bad breath. There's something wrong with his digestive system. And then there's ways in many cases to fix that. Because don't think it's just the breath. That's just the warning sign. That's just a symptom. That's not the cause. So if you have the bad breath like that, now, if you have rotten tooth, it has a different smell to it. I don't know if you ever smelled rotten tooth. It smells different. But if it smells like bowel, which is by far the most common, you got to get in there and fix the gut. And whenever I meet somebody with breath like that, I just, sometimes I'm in a social setting and I can't say it, but it's like, I got to fix that gut, man. Give me 30 seconds, But we want to check the nerve supply to the gut as well, because that controls the gut. And then we want to look at your diet. So don't ignore these warning signs, because they're very dangerous. They can cause some real serious problems. So if the bowels aren't moving properly, the bowels should move minimum once a day, preferably twice a day. Now, some people say I have bowel movements 5 times a day. That might be too much. So 1, 2, or 3 times a day, as long as it's normal and solid and it's not urgent, you're probably okay. But one of the things we do to screw up our digestive system, which then affects our bowel function, is we don't chew our food. I am guilty of this. When you chew your food, food is mixed with something called salivary amylase, spit. Spit has salivary amylase in it. And salivary amylase is an enzyme that breaks down carbohydrates. So when you digest food, fats, carbohydrates, and proteins are all digested in 2 different places. One of the places is going to be carbohydrate, your mouth. So you chew on it, salivary amylase. It goes into your stomach. The stomach is mainly designed to break down proteins. So your stomach has acid in it that breaks down proteins. So now this food that's been broken down partially from carbohydrates and proteins passes into your small intestine. This is the journey of food. And in your small intestine, your pancreas comes in and releases amylase, lipase, and protease, which are enzymes that break down carbohydrates, fats, and proteins. Then it's broken down there. So now proteins have 2 places, the stomach and the small intestine. Carbohydrates have 2 places, mouth and small intestine. And fats are broken down from the pancreas and then from your gallbladder, which releases bile. So each one has a backup plan. Okay, you got redundancy to keep you alive. If you have your gallbladder removed, how many people have had that? Raise your hands. A lot of you have. When you have your gallbladder removed, you remove one of the ways to break down fats, because the gallbladder stores bile. Now, bile is like dish soap. And when fat comes near it, it squirts the dish soap into the small intestine and breaks down the fat. If you don't have the gallbladder squirting out this large amount of dish soap, your liver still produces bile, but it drips essentially into the small intestine. And you don't have that big rush of bile like you're supposed to when you have a lot of fat in your diet, whether it's an avocado or it's, fried cheese. The gallbladder has to squirt this extra soap in there. So if that's not happening, you have trouble digesting your fats. And it increases your risk of a lot of diseases, including heart disease. So if you've had your gallbladder removed, and maybe you needed it, I'm not a surgeon. I can't tell you whether you need it or not. There's a supplement you should be taking. It's called Cholecol. Now, if you go to our website, drjoe.com, you can send me a message. What was that supplement again? You're not going to remember it. And I'll send you a link to it. And Cholecol is ox bile. Now, I don't eat meat. I don't eat any animal products. I don't think you should. But if you don't have a gallbladder, Cholecol is the most effective supplement you can take to help break down the fat. And it's an animal product. And I hate promoting an animal product. But it's the best product out there when it comes to not having a gallbladder. You should carry Cholecol with you every day. It costs almost nothing. It is so darn cheap, it's not even worth me even telling you about it from a business standpoint. But Cholecol, carry it with you. Whenever you eat something with fat, take a Cholecol capsule for the rest of your life. That's it. I think a bottle is like $8. I mean, it's so stupid cheap. So anyway, I digress. So we have to keep the digestive system working so that when you chew your food, that helps break down the carbohydrates. Up to this point, I haven't even mentioned fiber. We're talking all about these other peripheral things, but fiber is the thing that most people are missing in their diet. Recommended dose is about 25 grams a day. I recommend about 40 grams a day. So what happens is you eat fiber. Let's assume you're eating carrot, lots of fiber. Okay, so the fiber goes into your stomach. You chew it. Amylase starts breaking down the carbohydrates, salivary amylase. Goes into your stomach. The stomach breaks down the proteins in the carrot. Yes, carrots have protein. Goes into your small intestine, and it breaks down best it can. But there's something that's not digestible, and that's called the fiber. That's the bulk of it. And the fiber, as it goes through your colon, acts like a broom. And it sweeps the stuff that's stuck to the colon walls, and it pushes everything through the colon. Now, this is why I'm a fan of eating whole foods and not fruit juices. Because fruit juices are loaded with sugar, and they don't have a fiber. If I eat a carrot, or carrot juice has sugar too, if I eat a carrot, I have the fiber to push the sugar through the colon and give me a slow release of sugar. And I'm scrubbing my colon at the same time. So that's why fiber is so important. But I want to warn you, because somebody I work with at one of my radio stations, he takes a supplement every day, a powder, and he uses that to go to the bathroom with. Well, I'd rather see you eat the whole food than take a powder. And the powder he uses, by the way, has artificial sweetener in it. But you have to drink a lot of water. Because the water is going to swell up the fiber, whether you get it from organic oats or you get it from carrots or whatever it is, swell it up and then push it through the colon. If you eat a lot of fiber, like a powder for a supplement especially, and you don't eat enough water, it can have the adverse, a flip side, the reverse effect on you. It can actually cause constipation because it swells up but doesn't have water to push it through. Water is the lubricant. It kind of lubricates the sides so everything slides through. So I want you to eat more fiber. If you're eating your fiber from fruits and vegetables, you're getting lots of water. Nature put it all in a little package for you. I'm going to give you vitamins, minerals, nutrients, phytonutrients. We're going to give you fiber, and we're going to give you fluid. If I eat dried carrots, that's different. But I mean, if I'm just eating a carrot or broccoli or parsley or whatever it is, the water there is going to naturally help fill up and lubricate the colon. So be careful if you're taking supplements, especially with fiber in them. I'm not a fan of those, but I'm also a realist. If you're taking them, you better be drinking a lot of water. Now, how much water is a lot of water? Well, the rule is that you should be able to pee, and it should be clear and odorless. So if I pee in a glass jar and look at it, it should be clear and odorless. That's normal, and that's enough water. If I'm taking B vitamins, which I take every day, by the way, I take Dr. Joe's B complex. You should too. My pee's going to come out yellow. That's okay. That's just from the B vitamins. But generally speaking, if you'll take the B vitamins, one urine after that, or maybe two will be yellow. After that, should be clear. 6 glasses of water a day is probably a good start. Now, it has a lot to do with what you eat. If I'm eating watermelon, if I'm eating a lot of fruit, I'm getting a lot of fluid. So ideally, you want 8 glasses of fluid in your body. Not coffee, not scotch, good fluids. Fruits and vegetables, water from that. I do herbal teas a lot, water. Those are going to be the best fluids to get through the body, and it's going to be so helpful with your digestive system. So if there's one tip I got to give you right away, you got to drink more water or herbal teas. Not black tea, not green tea. Green tea tastes terrible, by the way. I don't know how people drink it. White tea, because they have caffeine in it, which I'm not a fan of. But oftentimes, like black tea, for example, can absorb aluminum from the soil. And just by absorbing aluminum from the soil, you can get aluminum in your body. So I'm not a fan of black tea either. I like the flavor, but it has caffeine, which I can't do. I get a blazing headache if I do caffeine. But it's also, you run the risk of aluminum, even organic. And then many times the tea bags that they use are white. Well, how do you think they got white? They were bleached. And so there's bleach getting in your body as well. So bulk tea is better than tea bags. If you get it unbleached, better. So there's some goods and bads there as well. But you got to get that fluid into your system and hydrate your whole body to help great. Now, we talked a little bit about acid reflux, and it's so important that you get that stomach pulled down away from the diaphragm if you have it. Because if you don't fix it, it usually doesn't go away on its own. The medications that you take, which are sometimes necessary, many of them prevent you from absorbing calcium, B12, iron, and magnesium. So many times we do nutrition workup on our patients. Sometimes it's just a form if you want to go more advanced. We could do hair analysis for nutrition. We could do food sensitivities. And I check people. And one of the things we find when we do a hair analysis is heavy metal toxicity, aluminum, mercury, lead. And with aluminum, you can absorb, if they drink a lot of black tea, you can get a lot of aluminum in your system. And aluminum, your body needs 0 aluminum to function normally. So any aluminum, any mercury, any lead, those are all very, very bad for you. They essentially short circuit your brain. So I'll ask people if they have high aluminum, do you drink a lot of tea? Yes. Okay, I want you to cut out your black tea. The other thing I ask is, do you use antiperspirant? Antiperspirant has a chemical in it called aluminum chlorhydrate, which can raise your aluminum levels in your body. And so I just had one the other day, a very dear friend of mine, actually. I did her analysis, and she had high aluminum. And it's my friend's mother, actually, but I'm my friend too. And I know she uses antiperspirant. And I had to tell her, can't use antiperspirant anymore. Well, I work hard and I sweat. You get aluminum in your body. What would you like to do? What I do for deodorant, as I go on a side note here, is I take rubbing alcohol and I add tea tree oil to it. The essential oil tea tree. And I add enough so that it smells like tea tree oil. Okay? And then I put it in a squirt bottle. I think I got it for $1 at one of the dollar stores. And I squirt it on my arms as I'm getting out of the shower. So the tea tree oil is antibiotic, antiviral, and antifungal, which kills the bacteria under my arms. And then the alcohols also can dry up the cells as well. And that works pretty well in most cases. And it's cheap too. So I want you to be healthy. I want you to have a lot of money too. So I'm giving you all these little tips here. All right, back to digestion. We talked earlier, if you're just joining us, I want to go over it with you quickly. The stomach sits below the diaphragm. If the stomach pushes up into the diaphragm, you may have to get us to adjust or pull your stomach down away from the diaphragm. It's life-changing. We do it all day, every day on so many patients. We have a quick test to do for it. And it's amazing because when your stomach flattens out, your breath starts to freshen, the gas goes away, bowels start working properly. Everything changes when you fix that gut, when you fix the stomach. So go to my website, drjoe.com, and type GERD, G-E-R-D, in the search bar, and you'll see the article that I wrote about how we do that. And then we also need more acid in our stomach. A lot of times when you have acid reflux, it's not that you have too much acid, you have too little acid. And if you don't have enough acid, the food sits in the stomach too long, and essentially it rots. When it rots, it refluxes back up into your throat. My mother used to call it sour burps. Wow, I just tasted that steak I just had, and that was 3 hours ago. Oh, I just tasted those onion rings I just had. That was 4 hours ago. That's the food sitting in your stomach for too long. So by increasing your stomach acid, I know it's counterintuitive, increasing your stomach acid, the acid then sends a message to the valve called the ileocecal lower esophageal sphincter, and it tells it to close. It closes because the acid says, oh, I got food in my stomach. That's producing acid. It's going to hit the lower esophageal sphincter and make it close. So increasing stomach acid many times with acid reflux is what you need to do. How do we do that? Well, there's supplements like Dr. Joe's Digestive Enzymes. I take those every time I eat cooked meals. If I eat soup, if I eat anything cooked, Dr. Joe's Digestive Enzyme. If I eat a salad, I don't take it because it's raw. It has enzymes in it already. But you can use raw organic apple cider vinegar. Now, what you do is take about a tablespoon. You can mix it with water. You can drink it. I put it on a salad every day. When I have my salad, I use apple cider vinegar, and that helps stimulate my stomach acid production. My German grandmother, she was an amazing cook, and she'd make a lot of soups, split pea soup, lentil soup, barley soup, and she'd always add a tablespoon of apple cider vinegar at the end before she served it. And I asked her, I said, Nanny, why do you do that? And she says, I don't know. It's how we always did it. That was the answer. We always did it that way. Well, it turns out they were right. That acid, that stimulates stomach acid, which helps break down the proteins, especially in things like beans, lower the gas that people got from it, and absorb the nutrients more efficiently. You want to use raw organic apple cider vinegar. It's very expensive. A bottle will cost about $5. It'll last you about a year. So it's one of the cheapest things you can do to help the digestive system. So you want to be able to do that. We talked about constipation earlier. I want to kind of circle back to that. Well, let me talk about one more thing. I don't want to run out of time. Many times when people have digestive issues, and they'll say, well, Dr. Joe, I'm eating fiber, I'm eating fruits and vegetables, I'm drinking water, it's still not working. Why am I still having problems? Many, many, many times, it's the nerve supply to the digestive system. So what happens is your brain sends messages down your spine, out your nerves to every cell in the body. So there's a nerve right now that is telling your heart to beat, your lungs to breathe, your colon to digest food. So if you have a pinched nerve going to your digestive system, the brain can't tell the colon how to work. And so now the colon does the best it can with the little information that it's getting from the brain. So we've had this countless times, many, many, many times, where we check the person out, they have a pinched nerve in their low back. Sometimes they have pain, sometimes they don't. 90% of the time, pinched nerves don't hurt. We check them, we say, okay, we're going to adjust the nerve supply going into your bowels. That nerve also controls your sex organs and your bladder too. And we start adjusting them, and all of a sudden, everything works better. The bowels start working again, and they're like, Dr. Joe, this is amazing. I've been doing everything right. I've been eating right. I've been drinking water. It was the pinched nerve that was preventing the digestive system from working. And that's why I say that you have to check the nerve supply to every organ in the body, regardless of what other treatment you do, because the nerve supply controls everything. So if you have back pain, leg pain, hip pain, it might be affecting your colon, sex organs, and bladder as well. So if you'd like for us to do an evaluation with you, we can check your digestive system, check your nervous system. Let's put together a protocol specifically for you. Make an appointment to come see us. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We can always do a remote consultation if we need to. drjoe.com, book an appointment. Stop suffering needlessly. So many of your health problems, neck pain, back pain, headaches, digestive issues, sciatica, they're fixable if we get the nervous system working, digestive system working, and your diet straightened out. Not always, but in many cases that helps. Check with your doctor. I always have to give you disclaimer, check with your doctor. But if you want to make an appointment for us to be your doctor or share you with another doctor, drjoe.com. Normally the first visit is $940. I've reduced that to $299. That's exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. I believe that is the most outstanding offer, deal, whatever you want to call it, in the history of healthcare. So drjoe.com, we'd love to be your doctors. We accept people with all insurances. It depends what your insurance covers. We have cash plans available, payment plans, 18 months without interest. I mean, we make it so easy to be a patient with us. drjoe.com, make an appointment right now. All the supplements we talked about, Super Green, Essential Source, digestive enzymes, glutathione. We didn't even talk about vitamin D today. You need that too. All those are on the website, drjoe.com. The minimum supplements you should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source. Those are 2 powders. You should take them every day, I say, for the rest of your life. It's just the easiest, quickest, least expensive way to get to this higher level of health that I don't know how else you'd get there. And then nitric oxide, of course, opens up blood vessels, vitamin D for the immune system, glutathione for the liver. We have something called intestinal formula, which is a great formula to actually stimulate the bowels and get the bowels moving. It's the only supplement I want you to take and then stop taking, because I want to fix the cause of your constipation, the cause of your bowel problems, not just treat the symptoms. So that's intestinal. And all those are on the website, drjoe.com. I would like for you to do me a favor. I just gave you some amazing information that's probably going to change your life forever. I want you to do me a favor in return. I want you to go and follow us on social media at Dr. Joe Esposito. If you liked what you heard now, you get 1-minute health tips every day on social media, absolutely free. So Facebook, Instagram, YouTube, TikTok, follow us on all of them. And I appreciate that as a favor to me because that helps build our awareness out in the community. So it's at Dr. Joe Esposito, all one word. And you're going to get so much information. If you have any health questions, send them to me through the website, drjoe.com, drjoe.com, and I'll answer them for you. My team or I will answer them for you. And if you're a podcast junkie, just go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it, and that's your podcast service. We do at least 2 podcasts a week, many times more. But you're going to get at least 2 new podcasts every single week on your podcast service. You have social media, 1-minute tips constantly. You have my website, drjoe.com, where you could send me questions. You could also search the website. Just go in there and type in what you're looking for. Neck pain, back pain, men's health, women's health, digestion, cholesterol, blood pressure. We've probably done multiple shows, blogs, podcasts on it, and you get to search the website and use all that information, and I that's my gift to you. So I don't know how to make it easier, folks. Today, I gave you so many tips that you can do at home. And I've got a bunch more. I just don't have time to do them. So that's why it's important to follow us on social media, because the ones I can't finish here, I kind of cover there. But follow us on social media. Any questions, drjoe.com. But consider this. When it comes to healthcare, whether it's digestive issues or heartburn or acid reflux or liver or spleen or kidneys or sex organs, you always want to check the nerve supply. And that's the one thing nobody's ever mentioned to you. If I came in a room and all the lights are out, what's the first thing I do? I don't change the light bulb. I flip the switch to open up the electricity to the light bulbs. And nobody, well, very few people in healthcare are talking about opening up the nerve supply to the organs. I believe this is the missing link in healthcare. This is the thing that's going to turn healthcare around. It's going to lower the cost exponentially, astronomically, because now we're getting to the cause of your healthcare problems and not just treating the symptoms. And we have to start incorporating nutrition into healthcare, in my opinion. And most doctors, God bless them, aren't trained in nutrition. I'll do that for you. Again, drjoe.com. Folks, thanks for tuning in. We'll catch you next time. What do you have? What do you have?
What is the best treatment for stress? My stress often comes from a busy schedule, tight deadlines, etc.
Okay, so you have to get your body working at a better level. So what that means is you got to start eating better. So if you're eating poorly, stop it. Go to my website, drjoe.com, type in, so what can I eat, and follow that advice. You got to, if you're stressed, you're using up a lot of nutrients like B vitamins, magnesium, and so you got to replace that. And so if you're stressed and you deplete your vitamin mineral supplies, well, then you're more stressed. So Dr. Joe's Super Greens, Dr. Joe's Essential Source, absolutely positively. Minimum supplements I would recommend every day. And then you have to figure out what else. Is there digestive stress, heartburn, acid reflux, diarrhea, constipation? We just talked about that. Is there physical stress? Neck pain, back pain, shoulder pain, headaches, numbness, tingling? Come see us. Let's fix that. And if there's emotional stress, we have to fix the gut. And I didn't even get into that today. But your stomach breaks down proteins into something called amino acids. The amino acid tryptophan becomes serotonin in your brain, and serotonin helps reduce stress. So if you have digestive issues, you got to get that fixed too, so you can digest your proteins to create the amino acids to produce the neurotransmitters to help with the stress. Go to my website, drjoe.com. I think type stress in the search bar. I think we did a show on that. If not, type anxiety into the search bar and listen to the show we did on that. It'll change your life. So come see us for the physical and the digestive stuff. You handle the chemical stuff.
I had an MRI for my lower back. Incidental masses on the adrenal glands were found, setting off at CT abdomen and blood work. A CAT scan showed benign masses, and up until now, all of my blood work returned normal or within normal range. The last two, cortisol, showed a low 5 and 6, and the decamethasone showed a value 374. Can you explain the last two? Is this good or bad, and what can be done naturally for healing?
Well, with cortisol, I don't like taking a one-and-done test because it only measures your cortisol at that moment in time. So you can, if you don't live in the Atlanta area, contact my office. I'll send you a saliva kit. And we take saliva samples throughout the day. And then what happens with cortisol, it's supposed to spike in the morning. That's what wakes you up. And then throughout the day, it's supposed to dip gradually until nighttime, and then you fall asleep. So that's normal. So we got to find out why your cortisol is so low and then see what we can do about it. I would recommend Dr. Joe's Adrenal Support, specifically for the adrenal glands. And then we got to find out, check the nerve supply to the adrenal glands, see if there's a pinch there. But the benign masses can be affecting cells. Those cells that should be where those masses aren't doing their job, obviously. Even though it's not cancer, it's still physically affecting the adrenals. So I would check the nerve supply. Let's do a full day. I mean, you spit in a tube every hour or two. It's really, really simple to do, relatively inexpensive. And let's find out what your true cortisol level is. You can't just do it at a moment in time. That just doesn't work. And then we got to figure out why the adrenal glands are malfunctioning. So I'd start with the adrenal test and Dr. Joe's Adrenal Support, Super Greens, and Essential Source. Check the nerve supply to the adrenals, and let's see where we can go from there. What else you got?
What are the best fruits to eat for high blood pressure?
All of them. Watermelon would be good because watermelon has citrulline in it. Citrulline converts into nitric oxide. I recommend Dr. Joe's Nitric Oxide Support because this converts into nitric oxide as well, which opens up the blood vessels. But fruit is going to have fiber in it, and fiber pushes everything through the colon. It's going to have fluid, which is going to help the body work better. But when I look at high blood pressure, I don't look at the fact you have high blood pressure. I want to know why you have high blood pressure. Sometimes it's a digestive system. Sometimes the stomach is up against the diaphragm, affecting the vagus nerve, and the vagus nerve can affect blood pressure. It could be you're low in nitric oxide. It could be that you're constipated. It could be you have a pinched nerve to the heart. High blood pressure is a warning sign. If you ignore it or just lower it unnaturally with chemicals, it doesn't fix the problem. So if I had to pick one fruit, watermelon, as far as vegetables go, beets and arugula are very high in nitrates, which convert to nitric oxide. All green leafy vegetables have nitrates in them. And this is going to be the granddaddy of them all, Dr. Joe's nitric oxide support. But go to my website, type in blood pressure in the search bar, and you can listen to a show we did on it. It covers a lot of that. But this you should be ordering right now. So, what else you got?
Do I need to take magnesium when I eat the super greens and essential source?
Probably not. If you're eating a lot of fruits, vegetables, nuts, and seeds, and you're taking super greens and essential source, you probably don't need extra magnesium. And nuts are good sources of magnesium, by the way, like almonds. What else?
That is all.
Beautiful. Folks, again, thank you so much. Again, please, I need a gift from you. Follow us on all social media at Dr. Joe Esposito. If you're listening live right now, put in hashtag live. If you're listening on a replay, put in hashtag replay. And I appreciate that again. And any questions you have, drjoe.com. But I hope to see you at my office. Let's solve those problems.